Feeling the radial artery is done by placing your index finger and middle finger on the underside and thumb side of the wrist. You will then count the number of heartbeats for a period of 15 seconds, after which you will multiply that number by 4, giving you the total BPM or beats per minute. When giving blood pressure, the subject should sit up or lie down with the arms stretched out. The arms should be level with the heart. Put the cuff about 1 inch above the elbow. Wrap the cuff snugly around the arm. There should be enough room to insert one finger between the cuff and the arm itself. Put the earpieces in your ear. Using your middle and long fingers, gently feel the pulse in the bend of the elbow. This is the brachial artery. You'll feel the pulse beating when you find it. Put the diaphragm of the stethoscope over the brachial artery pulse. Listen for the heartbeat. Tighten the screw on the bulb and quickly squeeze the pump to pump the bulb. This will cause the cuff to tighten. Keep squeezing the bulb until the scale on the gauge reads about 160, or until the gauge reads at least 10 points higher than when you last heard the heartbeat. Slowly loosen the screw and let the air escape from the cuff. Continue to listen and read the gauge at the point where the sound stops. The number of the first sound is systolic pressure, and the number of the second sound is the diastolic pressure. For a tricep fold, pinch the vertical skin fold halfway on the upper arm, as seen here. The chest pinch is taken between the nipple and the armpit. The skin fold is a diagonal one in the direction of the nipple and armpit. The mid-axillary fold is taken on the side of the torso at the 5th rib. The subscapular fold is taken approximately 2 centimeters below the bottom tip of the shoulder blade. The suprailiac fold is taken approximately 2 centimeters to the right of the iliac crest. The abdominal fold is taken 2 centimeters to the right of the belly button. This is a vertical fold. The thigh fold is taken halfway between the proximal patella and the inguinal fold. This is a vertical fold. For the 1 rep max bench test, the subject will begin by warming up with 1 set of 8 to 10 reps. After the warm-up set, the client will add an appropriate amount of weight. Here the client can be seen adding 10 pounds to each side, an equivalent of 20 pounds total to his bench. After 1 to 2 minutes of rest, the client will then begin a second set of 4 to 6 reps. After the completion of the second set, the appropriate amount of weight is added. Here you can see the client adding 10 pounds again to each side, a total equivalent of 20 pounds to his bench. After 2 to 4 minutes of rest, the client will attempt his 1 rep max. If the client succeeds in doing more than 1 repetition of the exercise, more weight will be added. Here you can see the client completing 3 repetitions of the exercise. Because of this, additional weight will be needed. From here on out, the client will add small increments of weight until he reaches his 1 rep max. Here the client can be seen adding 5 pounds to each side. After 2 to 4 minutes of rest, the client will again attempt his 1 rep max. The client has successfully completed 1 repetition of the exercise. This is his 1 repetition max of the bench press. The push-up test measures the endurance of the chest, shoulder, and tricep muscles. To begin the push-up, the client will bend his elbows and lower his entire body as a single unit. He will do this until his chin makes contact with the ground. Then he will return to the starting position by raising his entire body until his arms are fully extended. His body must remain rigid in a generally straight line and move as a unit while performing each repetition. If at any time the client bends or bows his back or cannot perform the exercise properly, the test is halted. The last good repetition will count towards his score. The YMCA step test will measure your client's aerobic fitness level. The equipment needed includes a stopwatch, a metronome, and a 12-inch box. On the command of go, the client will step up and down on the 12-inch box, staying in rhythm with the metronome. The metronome will be set at 96 beats per minute. After completing 3 consecutive minutes of the exercise, the client will immediately sit down and have his pulse taken for 1 full minute. The sit and reach will measure a client's flexibility. The client will sit on the floor with legs straight. There will be a measured tape in between his legs. There is a 15-inch foot line that will be marked. The client will then reach as far as he can, and the score is calculated from 3 trials. The shoulder test measures the flexibility of the shoulders. If the client's fingers are more than 2 inches apart, this is considered unhealthy. If they are touching or overlap, this would be considered good flexibility.